Om Shri Manjunataya Namaha. Good morning, everyone, and welcome to today's session on Sushruta Samhita. Without further delay, I would like to call upon Dr. Muralidhar Sharma sir, STM CAODP, to take over the session. Welcome to you, sir.
Next is about the virechanadravya vikalpa vijnaniyam adhyayam vyakhyasyaamah yathovacha bhagavantanantari. अरुणाभं त्रिवत्मूलं श्रेष्ठं मूलविरेचने प्रधानं चिन्वकस्त्वक्षु फलेष्वपि हरितकी तैलेषु एरण्डजं तैलं सरसे कारवेलिका सुधापयपयसूक्तम् इति प्राधान्यसङ्ग्रहः तेषां विधानं वक्ष्यामि यथावत् अनुपूर्वशः. Now for the Virechana yogas, according to Sushruta, the Trivruta, red Trivruta, is the most important or very powerful among the roots used for Virechana, and among the barks of the tree, Tilvaka bark is the better rather, and among the fruits or the seeds, Haritaki is the agria. Among the Tailas, Eranda Taila is the agria. Caramellica Swarasa is among the Swarasas, and among the latex, Sudha, that's the euphorbia. These are the better drugs used as. Now, Sushruta gives lots of plans like yogas of preparing these Virechana yogas, and practically most of these yogas are not really practically used. Like we limit to only a few of the yogas, but there is a lot of detail about the drugs like. वैरेचनद्रव्यरसान्वितं मूलं महत्त्रैवतम् अस्तदोषं चूर्णीकृतं सैन्धवनागराढ्यम् अम्लैः पिबेत् मारुतरोगजुष्टः. One of the yoga. Now among these you have a plenty of yogas according to the dosha conditions, and one of the yoga is you have to have any of the Virechana Dravya with Trivrta and to Saindhava Nagara. With the Amla Rasa, it has to be given for Martha Roga Vatavayadhi. For Pitta Vyadhi, Paitegade, Iksho Vikare, Madhurera sisters, Paitegade, Kshira Yutam Pipecha. In Pitta Vyadhi, before the Virechana, patient has to be given Ikshu Vikara, as it's sugar or maybe any of the preparations of the sugar cane or the juice of the sugar cane, and liquid has to be taken. Now, this is a very slightly difference in the perception. According to Sushruta, before the Virechana, the patient has to take some specific liquids, which we generally don't use practically we don't do that. And the liquid which is to be taken according to Sushruta is according to doshas. In case of Bhataja, it has to be a Saindhava Nagaradhyam Amdehi Amrasa with Saindhava Nagara. In Pittaja Vyadhi, it's Ikshu Vikara, either Ikshu Rasa or so on. Whereas in Kapaja, Guduki Arista Chikalarasena Sabhyoshamutram Kapaja Pibeta, Gumutra with the Guduki Arista and the Trikadu. त्रिवर्णकत्युषणयुक्तम् एतद् गुडेन लिष्यात् अनवेन चूर्णं प्रस्थे च तन्मूलरसस्य दत्त्वा तन्मूलकर्कं कुडवप्रमाणं कश्रोन्मिते सैन्धवनागरे च विपाच्य कल्कीकृतम् एतदद्यात् तत्कल्कलादः स महंसधात्तः स सैन्धवो मूत्रयुतश्च पेयः. Now coming to the yogas are either a bit more detailed yoga where a leha kalpana is prepared, and the leha kalpana is done by the Trivrata, Trivushana and Guda. That's one sort of leha, or and it's a prastha, one prastha of the rasa, the juice of that is prepared, and added to that Karshunmita Saindhava Nagarita. Saindhava and Shuddhi has to be added further, and it has to be processed into a form of kalka, it's sort of leha, and this has to be given as a Virechana with Gomutra. समाहतिवर्त नागरकाभयाः स्युः भागात्मकं पूगफलं स्पर्कुं बिडङ्गसारो नरिचं सदारो योगः ससीभूद्भव मूत्रयुक्तः विरेचनद्रव्यभवं च चूर्णं रसेन तेषां भीष्टाभिमृत्य तन्मूलसिद्धेन च सर्पिषाक्तं सेव्यं तदाज्ञे गुडकीकृतं च गुडे च पाकाभिमुखे निधाय तीर्णीकृतं सम्यगिदं विपाच्य शीतं त्रिजाताक्तम् अथो विमृत्य योगानुरूपाः गुटिका प्रयुज्याः. Another leha and then gutika. with the Trivrta, Nagara, Abhaya, and Pukapala, and Vidanga, Maricha. These are to be prepared in the form of a gutika with the ghrita, added with the ghrita, and the process of preparation is a bit complex. Then वैरेक्य द्रव्यचूर्णस्य भागं सिद्धं सार्धं क्वाथभागैः चतुर्भिः आनुज्ञात् सर्पिषा तत्सृजेन तत्क्वाथ ऊष्मस्वेदं सामितं च पाकप्राप्ते फाणिते चूर्णितं तत् क्षिप्तं पक्वं च अवतारे प्रयत्नात् शीतीभूताः मोदकाः हृद्यगन्धाः कार्यास्त्वेते भक्ष्यकल्पाः समासात् a modaka can be prepared with the virechanadravya churna and then the a quarta of the virechanadravya churna is prepared and with the sarpi ghrita is added and it has to be processed until it becomes somewhat semi-solid hanita and then you have to add the churnas of different varieties of the food substances and prepare a modaka and it can give a pleasant smell. This is one of the options given. Or another option, रसेन तेषां परिभाव्य मुद्गान यूषः ससिन्धुद्भव सर्पिरिष्टः वैरजने अन्यैरपि वेदनैः स्यात् एवं विदध्यापो मनौषधीश्च. Now, virechana dravya can be prepared into a yusha and you add mudga, black gram, and then sindhu, that saindava rabana, and sarpi, ghrita. This can be prepared as a yusha. So, the whole issue is that the virechana dravya can be given in any form which could be of different varieties of the food, which is also called as pravicharana, the different sources of the pravicharana. So, and the types of the food substances, varieties of the food substances used in those days are of that sort, yusha, mudga, modaka, etc. और भित्वा द्विधा इक्षुं परिलिप्यकल्कैः त्रिभण्डिजातैः प्रतिबध्य दत्वा पक्वं च सम्यक् पुटपाकयुक्त्या खादे तं पित्तगदी सुषितम्. Another of the preparation is putapaka, where the sugar cane is split into two and then you add that kalka of the trivrta and it has to be processed in fire in a form of putapaka where it has to be covered with the mud and then kept in the fire and then after it has become rather heated properly it has to be eaten for pittagadi, pittaja vyadhi. सीता अजगंधात्व क्षीरी विदारी त्रिवृतस्समाः निश्यात् मधुकृताभ्यन्तो दृढदाह ज्वरशान्तिः. In the patients who have burning sensation and jwara, if they have to give virechana, this is the yoga preferred where sugar and then ajagandha, twak, kshiri, vidari, etc. they are added. और शर्करा क्षौद संयुक्तं त्रिवच्चूर्ण अवचूर्णितं लेजनं सुकुमाराणां त्वक्पत्र मरितांशकम्. Another yoga for sukumara for delicate constitution, शर्करा क्षौद्र त्रिवच्चूर्ण and त्वक्पत्र मरिता added. पचे लेहं सीता क्षौद्र पदार्थ कुडवन्तं त्रिवच्चूर्णं शीतं पित्तग्नं तद्विवेचनं. In pittaja vyadhi, a leha prepared with the trivachurna with the Sita Kshodra. Now, Trivat Leha, which we use quite frequently, is of a similar yoga. Now, in the practically, most of the times when we give Virechana, we prefer Trivat Leha because it's somewhat suitable for all. Ichha Vedi Rasa often produces more severe purgation in others. And the other varieties of different varieties of the Virechana yoga, of course, they may be useful, but practically very rarely we use those kinds of different yogas. Now the other yogas which are mentioned are Trivrta Kshama, Kshara Shuddhi, Pippalihi, Madhunapniya, the Sarva Shleshma Vikaranam Systemated Virechanam. Another of the yoga for Kapaja Vyadhi. Bijadhyapatya or Kashmiriya Dhatri Dadimako Rajan, Tailabhistan Rasan Amra Palihi Avapya Sadhet, Dhani Bhutam Tri Saugandhi Trivrta Kshaudra Samanvitam. लेह्यम एतत् कफ प्रायैः सुकुमारैः विरेचनम्. Another of the लेह yoga. नीली तुल्यं त्वगेरं च तैः त्रिवृत सौपरा चूर्णं संतर्पणं क्षौत्रपराम्लं सन्निपातन. तो for त्रिदोष व्याधि this a चूर्ण yoga is suggested. त्रिवृत श्यामा सीता कृष्ण त्रिफला माक्षिकी समेहि मोदकाः सन्निपात ऊर्ध्व रक्तपित्त ज्वरापहाः. Another of the yoga which is mentioned for sannipata and ऊर्ध्व रक्तपित्त ज्वरा. त्रिवृत भागाः त्रयः प्रोक्ताः त्रिफला तत्समा तथा क्षारकृष्णा विडङ्गानि सञ्चूर्णे मधुसर्पिषा निह्यात् गुडेन गुटिकाः कृत्वा वापि अथ भक्षेत् कफवातकृतान् गुल्मान् प्रीहोदरहरीमुखान् Hanyan, Hanti Anyan Napi Chapiet, Nirapayam Vilachana, of the Nirapaya Vilachana, where there will be no complications, where again it's a sort of Trivirth Leha, Trivirtha and Triphala, Kshara, then Krishna is Pipali, Vidanga, these are added and then you have to prepare a Leha. चूर्णं श्यामा त्रिवत् नीली कट्वी मुस्तादुरारभा चव्य इन्द्रबीजं त्रिफला सर्पिः मांसरसाम्बुभिः पीतं विरेचनं तद्धि वृक्षाणामपि शस्यते. Another मांसरसयुक्त विरेचन yoga for those who have very ruksha body. वैरेचनिक निक्वात भागाः शीताः त्रयोमराः द्वौ फाणितस्य तच्चापि पुनरग्नौ अधिश्रयेत तत् साधु सिद्धं विज्ञाय शीतं कृत्वा निधापयेत कलसे कृतसंस्कारे विभज्य ऋतून् हिम अहिमौ मासादूर्ध्वं जातरसं मधुगन्धं वरासवं पिबेद असौ एव विधिः क्षारं मूत्र आसवेष्वपि. Another asava yoga where the Velechanika Kwatha is prepared with the into a panita, it's converted into a panita where jaggery is added, and then it has to be fermented as a fermented product also can be used for the Velechanika. वैरेचनिकमूलानां क्वाथे माशान् सुहापितान् सुधौतान् तर्कषायेण शालीनान् कतण्डुलान् अवक्षुज्य एकतपिण्डान् कृत्वा शुष्कान् सुचूर्णितान् शालितण्डुलचूर्णं च तत्कषाय भूष्मसाटितं तस्य पिष्टस्य भागान् त्रीन् किण्वभागविमिश्रितान् मण्डोदकार्थे क्वाथं च दद्यात् तत्सर्वम् एकदा निरध्यात् कलसे तां सुरां जातरसां पिबेत एष एव सुराकल्पः वमनेष्वपि कीर्तितः. Another surakalpa, a alcoholic preparation where the virechanadravya dravya quatra with the black gram is processed, and the black gram seeds as well as rice is dipped in this kashaya and then it is dried up, and once it has become dried up you prepare a powder of this, and with this powder you ferment it and then prepare something like a beer, and this kind of an alcoholic preparation yasura also can be used for virechana as well as omana. मूलानि त्रिवृतादीनां प्रथमस्य गणस्य च महतः पञ्चमूलस्य सर्वशार्ङ्गेष्ठयोरपि सुधां हैमोतीं चैव त्रिफला अतिविषयपचां संहृत्य एतानि भागौ द्वौ कारयेत् एकमेतयोः कुर्यान् निक्वातम् एकस्मिन् चूर्णमेव च क्षुण्णान् तस्मिन् निक्वाते भावयेत् बहुशो यवान् शुष्काणां मृदुभृष्टानां तेषां भागाः त्रयोमताः चतुर्थं भागवाम् आवाप्य चूर्णानाम् अत्र कीर्तितं प्रक्षिप्य कलसे सम्यक् ततस्तं तदनन्तरं तेषामेव कषायेन शीतलेन सुयोजितं पूर्ववत् सन्निदध्यातो ज्ञेयं सवीरकं तत्. Another savirakasura, another of the alcoholic preparation where again you have to have these dravyas. Prasamagana is a Vidari Gandhadigana, and then all that Mahapanjamula, Sharmi, Murva, etc. These drugs are added with the yava, the grains, and this is again processed and fermented where the alcoholic percentage will be more. Saviraka is where the alcoholic percentage will be more. पूर्वोक्तं वर्गम् आहृत्य द्विधा कृत्वा एकमेतयोः भागं संशुद्ध्य संसुद्ध्य यवैः स्थाल्याम् अधिश्रयेत् अजशृङ्ग्याः कषायेण तम् अभ्यासित्य साधयेत् सुसिद्धां च अवतार्य एतान् औषधिभ्यो विवेचयेत् विमृत्य सतुषान् सम्यक् ततस्तान् पूर्वन्वितान् पूर्वोक्त औषधभागस्य चूर्णं दत्त्वा च पूर्ववत् तेनैव सह यूषेण कलसे पूर्ववत् क्षिपेत् ज्ञात्वा जातरसं चापि तत्तुशोदकम् आदिशेत् तुषां सवीरकयोः विधिः एष प्रकीर्तितः क्षद्रात्रात् सकरात्रात् च पेये प्रकीर्तितः. Now these Saviraka or Tusham yoga. Saviraka is fermented, Tusham is non-fermented yoga, where again similar substances are processed and that whole process is better a complex where you will have follow many steps. Vairechaneshu sarveshu Trivit Mula Vishismritaha. In all that Vairechana Trivit Mula has to be used quite commonly. Dante Dravantyoh Mulani, Visheshata Mృత Krushantere पिप्पली क्षौरयुक्तानि सिन्नानि उद्धृत्य शोषयेत् ततः त्रिवृत्तिविधानेन योजयेत् श्लेषं पित्तयोः. When Trivati is not available or if you do not feel like using the Trivata, other option could be Danti Dravanti Mula, which has to be kept in covered with the mud and then kusha, kept stored in that manner, and then it has to be prepared with the processed with the Pippali Kshaudra, and then it can be administered. तयोः कल्ककषायाभ्यां चक्रतैलं विपाचयेत् सर्पिश्च पक्वं विसर्पकक्षादाः अलजीः जयेत् मेहगुल्म अनिलश्लेष्म विबन्धान् तैलमेव च चतुस्नेहं सकृत शुक्रवातसंरोधजाः रुजः. Another taila can be used where kalka kashaya of similar drugs are used with the chakrataila. Chakrataila is a freshly extracted oil immediately after the extraction, where there is a no degeneration or fatty changes or no oxidation changes in the oil that occur. Sarpishta pakkum visarpa kakshadaha, these are used for visarpa kaksha etc. and meha gulma such vyadhis, and it can be processed with the all forms of the sneha. Chatu sneha can be used. Dandi dravanti maricha कनक कनकाह्वय वासकैः विश्वभेषज मृद्विका चित्रकैः मूत्रभावितं सप्ताहं सर्पिषाच्यूर्णं यज्ञमेतद्विरेचनं जीर्णे सन्तर्पणं क्षौद्रं पित्तश्लेष्मरुजापहम् अजीर्णपार्श्वरुक्पाण्डुपीठोदरनिबर्हणम्. In diseases like ajirna and the Pashwaruko, etc., one of the form of the virechana is where the virechana is given for 7 days. Now, this is not again practically done. Most of the times we limit to the virechana for a day, but Sushruta refers to another sort of the virechana where the virechana can be given for 7 days, and the yoga suggested is again Danti, Dravanti, Marichak, etc., which can be given in the form of a churna for 7 days. गुडस्य अष्टपदे पथ्य विंशतिः स्युः फलं फलं दन्ती चित्रकयोः कर्षोऽपि परित्रिवृतो दश कृत्वा एतान् मोदकान् एकं दशमे दशमे हनि ततः खादेत् उष्णतोयसेवी निर्यन्त्रणस्तु इमे दोषज्ञा गृहिणी पाण्डुरोग अर्षकुष्ठनाशनाः. Now, another form of the Virechana Yoga which is mentioned in Sushruta is where you will give Virechana Trivya once in 10 days, and that preparation would be the same Buddha Pathya with that, and the person has to consume it once in 10 days for the treatment of the diseases. Now, during this kind of Virechana, whether there has to be a snehana process or not, that's the question mark. In Bhagavata, you do not have these kinds of the variations. These variations are mentioned in Sushruta, as well as you will have a similar variations in Charaka also. वेषं त्रिजातकं मुस्त विडङ्ग आमरके तथा नव एतानि समांशानि त्रिवृदष्टगुणानि च वै श्लक्ष्णचूर्णीकृतानि इह दन्ती भागद्वयं तथा सर्वाणि चूर्णितानि इह गानितानि विमिश्रयेत् षड्भिश्च शर्कराभागैः ईषत् सैन्धवमाक्षिकैः पिण्डितं भक्षयित्वा तु ततः शीतामुपायेत् बस्तिरुक् त्रिरुज्वरच्छर्दि शोषपाण्डुभ्रमापहं नियन्त्रणमिदं सर्वविषघ्नं तु विरेचनं त्रिवृत अष्टकसंज्ञोऽयं प्रशस्तपितरोगिणां भक्षः क्षीरानुपानो वा पित्तश्लेष्म आतुरैः नरैः भक्ष्यरूप सधर्मत्वात् आढ्येष्वयो विधीयते. Another form of virechana which has a similarity to that of the regularly consumed food, and hence it's preferable in case of Vishavyadi as well as any of the other Pitta Roga. And because it has a comfortable appearance and looks like a food, so should suggest that it can be given in rich persons. तिलकस्य त्वचं बाह्यम् अन्तर्वल्क विवर्जितम् चूर्णयित्वा द्वौ भागौ तत्कषायेन कारयेत् तृतीयं भावितं तेन भागं शुष्कं तु भावितं दशमूली कषायेन त्रिवृत् संप्रयोजयेत् विधानं तु त्वक्षनिर्दिष्टं त्रिवृत् त्वक्, and this is about the त्वक् yogas. त्रिवृत् त्वक् can be used. फलानाम् अथोक्षते फलयोग हरिसत्याः फलं तु अस्ति विमुक्तं दोषवर्जितं योज्यं त्रिवृत्विधानेन सर्वव्याधिनिबर्हणं रसायनं परं मेध्यं दुष्ट अन्तर्व्रणशोधनं हरितकी विडङ्गानि सैन्धवं नागरं त्रिवृत् मरिचानि च तत्सर्वं गोमूत्रेण विरेचनं हरितकी भद्रदारु कुष्ठं पूगफलं तथा सैन्धवं शृङ्गवेरञ्च गोमूत्रेण विरेचनं नीलिनी फलचूर्णं तु नागर अभययोस्तथा लिश्यात् गुडेन सलिलं पश्चात् उष्णं पिबेन्नरः पिप्पल्यादिकषायेन पिबेत् पिष्टां हरितकीं सैन्धव उपहितां सद्य एष योगौ विरेचयेत् हरितकी भक्षमाणा नागरेण गुडेन वा सैन्धवोपहिता वापि सातत्येन अग्निदीपनि वातानुलोमनि वृष्या च इन्द्रियाणां प्रसादनि सन्तर्पणकृतान् रोगान् प्रायो हन्ति हरितकी. Now, different Haritaki yogas, Haritaki which can be administered with the different varieties of the drugs like Haritaki Vedanga Saindava or Haritaki Bhatradara Kusta or with the Haritaki Nilini Falatuna and Shunki. so on. So there are many yogas mentioned which could be of Haritaki. And in general, Haritaki yogas are Vatanulomani, Vrishya, Indriyanam Prasadani. So when you consume Haritaki yogas for the Virechana, it helps in resolution of all Santarpanakrita Vyadhi, all sorts of the diseases produced due to excess of consumption of the calories and Vatanulomana, Vrishya, etc. शीतम आमलकम वृक्षम पित्तम एतपापहम बिभीतकम अनुष्णं च कफपित्त निबर्हणं त्रीणि अपि आम्लकषायाणि सतिक्त मधुराणि च now haritaki vibhitaki and amalaki the triple it gives a good combination and this is about the drugs which could be used as such. Now, Trifala Sarorogni Tribhaga Gratamuchita, Vaisasthapanam Chapi Kuryat Santata Sevita. Trifala is one which can be used regularly as Vaisthapana. Haritaki Vidanena Palanyam Prayata, Virechana and Sarvani. Similar as in case of Haritaki, Tripala Churna also can be given along with the other drugs. Now, the next is Chaturanga. The विशेषात् चतुरङ्गलात् फलं काले समुद्रस्य सिकतायां निधापयेत् सप्त आरब्धफल and it has to be that the seeds or rather the whole arabdha that fruit itself, it has to be processed by keeping it in sand for 7 days and dried in heat, this sunlight. Sapaham Atape Shishkam Ato Majan Udhret, then the Majja has to be taken, that latex portion or sticky portion within that fruits has to be collected. तैलं ग्राह्यं जले पक्त्वा तिलवद्वा प्रपीड्य च तस्य उपयोगो बालानां यावद् वर्षाणि 12 आरब्धे is a mrudu virechanadravya and it can be either it could be the majja or the taila prepare can be prepared either with heating in water, boiling in water, or by grinding as in case of tila. And this taila is used for children up to 12 years. विषयाद् एरण्यतैलेन कुष्ठत्रिकटकटकान्वितं सुखोदकं चानपि भेद एष योगः विरेचयेत्. Another Sukha Virechana Yoga with the Erandataila, Trikatu, and warm water. Erandataila, Tripala, Patena, Tripudanato, Yuktam, Pitam, Thrak, Shira, Sabhyam, Tivirechayeta, Bala, Udakshatakshina, Sukumaresh, Tampala, Namidhi Now, Erandataila also can be used along with the phalas. Now, next is Kshira Yogas. Kshiranam Shruta. विरेचनानां तीक्ष्णानां तयः सौधं परं व्रतम् अज्ञप्रयुक्तं तद्धन्ति विषवत् कर्मविभ्रमात् विजानता प्रयुक्तं तु महान्तमपि सञ्चयं विभिन्नति आश्वेव दोषाणां रोगान् हन्ति दुस्तरान्. Kshira is the latex of the plant, not the milk, and Tikshna milk can be used, that latex can be used with very careful, and Sushil says it has to be done very carefully, because the latex of the plant, if it is administered in a wrong manner, it can even produce a poisonous effect. Ajnaprayittam tadhanti vishavat. So, and hence you have to have a very careful control on that. Practically, we don't use the latex for the purgation. महत्याः पञ्चमूल्यस्तु बृहत्याः एकशशक्ततः कषाये समभागं तथा अङ्गारेषु शोषितम् अम्लादिभिः पूर्ववत् यो त्रैलोक्यं कोलसंहितं महावृक्षपयपीतैः अवाघो तण्डुले कृता पीताः विरेचयत्याशु गुडेन उत्कारिका कृता लेहो वा साधितः सम्यक् स्नुहि क्षीरपयोघृतैः भावितास्तु स्नुहि क्षीरे पिप्पल्यो लवणान्विताः चूर्णं काम्पिलकं वा पीतम् उचिकीकृतम्. Now, Kshira Yogas, where latex of the snuhi is used along with the other drugs like Mahapanchamula, Bhihati, etc. Saptala Shankini Danti Trivuta Arakudham Gavam Mutrena Aplavya Saptaham Snuhi Kshire Tataparam Kiran Tenima Churnena Mandim Vasanamemaja Agraya Avartya Vatsamyak Mudukostho Virichate. For the Mudukostra, Kshira Yoga is with the Snuhi Kshira, you have to use Saptala Shankini Danti, etc. And it's not to be consumed, it can be malyam mosanamemacha. If it is kept over the body in the form of mala or cloth or smell, just smell it, with that only, it's not to be consumed. This yoga is not to be consumed. A agrana yoga or the yoga which is applied over the surface of the body, it can produce virechana in a Mridu Kosta patient. Now, these are all the things which need to be tried. We don't have a practical experience. Like when if a Virechana can be induced by applying something over the body or applying it over the cloth, whether it can produce a Virechana. These are all to be tested and confirmed. So I don't know whether it's really practically useful or not. क्षीरत्वक्फलमूलानां विधानैः परिकीर्तितैः अवेक्ष्य सम्यक् रोगादीन् यथावदुपयोजयेत् त्रिवृक्षाणां मिताः तिस्रश्च त्रिफलाकृतः विडङ्गपिप्पलीक्षार क्षाणाः तिस्रश्च चूर्णिताः लिष्यात् सर्पिर्मधुभ्यां च मोदकं वा गुडेन च वा भक्षयेत् निष्परिहारम् एतत् श्रेष्ठं विरेचनं गुल्मं प्रिहोदरं कासं हरीमुखं रोचकं कफवातकृतानश्च अन्यान् व्याधीन् एतद्विपोहति. Now, Kshira, Pakapala, Mula, all these can be added together and they can be used very carefully with the specified yogas, and then only it can produce a relief from many diseases like Bidanga, Pipali, Kshara. These are commonly added to all these yogas, majority of the yogas, and this produces a Nishparihara Virechana. Nishparihara Virechana is where there is no complications and there is no need of follow-up treatment. घृतेषु तैलेषु पयस्सु चापि मद्येषु मूत्रेषु तथा रसेषु भक्ष्यान्नलेह्येषु च तेषु विरेचनानि अग्रमतिर्विदध्यात्. A virecana dravya can be given in any form, either in the ghrita, taila, madhya, etc. And that selection of the form would be based upon the intellectual capacity, experience of the physician. क्षीरं रसत् तर्कमथो कषायः श्रुतश्च शीतश्च तथैव चूर्णं कल्पाः षडैते खलु भेषजनां यथोत्तरं ते लघवः प्रतिष्ठाः. The yogas of Kshira, Kalka, Kashaya, Sruta, Shita. These are in a gradually progressive form of Laghu. Among the 6 yogas, they are Laghu. This is what Sushruta has mentioned. Now, some of the protocols, how to use them, and then a simplified protocols of this is in Vagbhata. So, because contextually, most of the details which are mentioned in Sushruta are not in practical use now in majority of the centers, and most of the times we follow what's mentioned by Vagbhata, which has a clear-cut guideline. So I refer to that part also. When I say this, I don't mean to say that whatever the information which is present in Sushruta is useless, but is not being used in majority of the centers. That's all the point. So we need to maybe study it, and then if it is possible, it has to implement. Now, Bahupitah Mrudu Kosto Chirena to reach a Prabhuta Maruta Kruha Krutchat Shamadike Rapi. Now, whenever you give Viretana, the Kosta Pariksha is one of the important issues. A patient with the Pitta Javyati and Mrudu Kosta, simple kshira, milk can be enough to produce the Viretana. Whereas a patient with the Vata Javyati and Krura Kosta, even with very strong purgatives, the patient may not have the Viretana. And whenever you select the drug should be Kashaya Madhurehi Pitte Virekaha Katukai Kape Stigdostu Lavadehi Vayohu. Now, selection of the drug would be according to the dosha condition. If it is a Pitta Javyati and you have to give the Viretana, prefer Kashaya Madhura Rasa Dravyas. If it's a Kapha Javyati, Katu Dravyas. And in Vata Javyati, Snigdha Usna Lavana, the common formula. Apravurtopayet, suppose after giving the Virechana, if the Virechana doesn't occur within that specified time, then Usnam Dushadaya Dasya Pandapena Chodaram, you have to give warm water to the patient, and if necessary, you may have a fermentation over the abdomen with the warm hand, or Swedana can be done over the abdomen with warm hand as such. Utthane Alpe Dine Tasmin Bhukva Anyedyuhu Punah Pivet. अधर सेहकोशतो पिबेद ऊर्ध्वं दशाहतः भूयो अपि उपस्कृततनुः स्नेह स्वेदैः विरेचनं यौगिकं सम्यक् आलोच्य स्मरन् पूर्वमतिक्रमम्. Now, if even this fails to produce the virechana, then the next utthane alpedine, the next day, patient has to consume some food, and then again you give the virechana. And the possibly, if the patient is not having sufficient snehana previously, and then if suppose the snehana was not sufficient, then you will have to give the virechana again following the snehana protocol after 10 days. So When the virechana doesn't occur with a virechana dravya, you have a very practical protocol. So one option is you give warm water. If even this also doesn't help, then the next dose of the virechana has to be given only the next day. If even that fails, then you'll have to start with the again Snehana protocol and give the Virechana after 10 days. It's not that you go on giving the Virechana Dravya continuously. Bhuyo Vipaskrita Tanu Sneha Sridehi Virechanam Yaugikam Samyak Alokya Smaran Purum Atikramam. So you need to have your experience and then that has to be used. And this is practically true. It's not that you go on giving the doses on the same day, waiting, having some urgency. Like that's not the right thing. Right thing is you'll have to wait at least for 1 day. हृत्कुक्षे अशुद्धिः अरुचिः उत्क्लेशश्लेष्मपित्तयोः खण्डुः विदाः पीडिकाः पीनसो भातविग्रहः अयोगलक्षणम्. Now, in case of ayogya lakshana, if the yoga, this virechana has not been sufficient, it can produce the symptoms like hritkuksha ashuddhi. Patient would not have that comfort in the abdomen, and aruchihi, dyslexia, utklesha, salivation, and then nausea. Shlesham pittayoho, kandu vidaha, kanduhu, itching. It's very common. One of the frequent complications of improper virechana is allergic reactions tend to be precipitated. Now, this is a very interesting issue. Virechana is often administered in case of allergic diseases as a treatment, but if the virechana protocol is not followed, one of the very frequent complications is allergic reactions. Pitikaha, that could be eruptions. Penasaha, the patient may have even a persistent rhinitis. All formation, all different presentations of the allergic reactions. Vata Vidgraha, patient may have a constipation. Now, Vaiparite yathoditath विट्पित्तकफपातेषु निःश्रितेषु क्रमात् सवेत् निःश्लेषु पित्तम् उदकं श्वेतं कृष्णं सलोहितं मांसधावनतुल्यं वा मेदखण्डाभमेव वा बुधनिःसरणं तृष्णाभ्रमो नेत्रप्रवेशनं भवन्ति अतिविरिक्तस्य तथा अतिवमनामयाः. Now, Ativirechana yoga Ativirechana can produce a Nishleshma Pittam Mudakam, only water without any kapha or any mucus content or no even bile content. And when the purgated product, the extracted product is a whitish or blackish or with blood stained or where you have some soup-like appearance, mamsadhavan tulyam, or medakhandapameta, solid pieces of the flesh tissue, soft tissues are or udanissanam, prolapse of the anus, Trishna, Brahmaha, the impaired consciousness, they can occur, or all that complications which are mentioned in Ati Yoga Priyomana, they could occur in case of Ati Yoga Virechana. A proper Virechana will result in expulsion of feces, then Pitta, and then Kapha, then the Vata. This sequence is maintained in a proper Virechana. सम्यक् विरिक्तमेनं च वमनोक्तेन योजयेत् धूमवर्ज्येन विधिना ततो वमितवानिम क्रमेण अन्नानि भुञ्जानः भजेत् प्रकृतिभोजनम्. After virechana, as in case of vamana, the patient has to follow samsadhyana krama, except dhumapana. Dhumapana is not necessary in virechana. Other than that, the samsadhyana krama is important. Mandavanyam asamshuddham akshamam doshadurbalam adrishta jirnalingam langhayet pitabheshram. Suppose if the patient after the virechana continues to have the ajirna action, he may continue to have the purgation even after 1 or 2 days, then the langhana has to be given, followed. It's not simply the samsajana krama. Patient has to be maintained on langhana till he has better jirna lakshanas. संशोधन अस्त्रविस्रावस्नेह योजनलङ्घनैः यान्ति अग्निः मन्दतां तस्मात् क्रमं पेयादिम् आचरेत्. That samsadhyana krama is necessary in case of samshodhana, all that woman virechana or rakta mokshana or sneha krama or any of those sneha yojanas. And hence, in all such conditions, a payadi krama, that samsadhyana krama, gradual increase in the quantity and quality of the food is necessary. सुधा अल्पपित्त श्लेष्माणं मध्यपं वातपेतिकं पेयाम्न पाये तेषां तर्पणादिक्रमो हितः. If the patient is an alcoholic patient and the patient's yoga, virechana yoga is not seen properly, a asamyak virechana patient, Now, in such conditions, Tarpanadikrama, that's your gradual Samsadhyana Krama, may not be sufficient or it's not suitable. Instead, the patient has to be, that your Samsadhyana Krama is not suitable. Instead, Bhagavata suggests about a process called Tarpanadikrama. That Tarpanadikrama is a unique process mentioned in the Bhagavata, where प्रथमे अन्नकाले राजसत्त्वः द्वितीय अन्नकाले मांसरसोदनम् इत्येषः तर्पणादिक्रमः. Instead of going mandapaya virepi, in the first, immediately after the virechana, patient can be given laja sattu, the sattu, that dried powder of laja. Then next, in the next time in date, mamsarasa odana, with the mamsarasa food can be given. This is because it's not following that mandapaya vikrama. It's somewhat more guru and dry substances which are given only in the patient of Madhyapa and Vatapaitika. Madhyapa is alcoholic and patient who has a more of Vatapitta Vyadi and the Lakshanas of Veda are not sufficient. Alpapitta Shleshmana, which are the expulsion of the Pitta and Kapha is not sufficient during the Berechana. In such patients only this kind of process protocol is suggested. दुर्बलः बहुदोषश्च दोषपाकेन स्वयं विरिच्यते भेदनीये बुद्धि तम उपादेयत. If a patient has already a propulsion or already a passage of the stools, virechana already is occurring due to the bahudosha and doshapaka, in such conditions, instead of giving another course of virechana or instead of blocking that purgation, Vedaniya Buddhi, you'll have to prefer food which can produce or which can increase the quantity of the expulsion. So, Vedaniya food has to be given. दुर्बलः शोधितपूर्वम् अल्पदोषकृशो नरः अपरिज्ञातकोष्ठश्च पिबेत् मृदु अल्पमौषधं वरं तदसत्कृत्पीतम् अन्यथा संशयावहं हरेत् बहूंश्चरान् दोषान् अल्पान् अल्पान् पुनः पुनः दुर्बलस्य मृदुद्रव्यैः अल्पान् संशमयतु तार्णम्. Now, whenever you give virechana, it's always better to give a virechana dose. The dose of the drug could be less than a optimum. It should not go into atiyoga. And when you are not able to assess the kosta of the patient, then it has to be preferably mrudu alpa, mrudu dravya alpa option. Now, what we do practically is majority of the patients we prefer Trivakleha than any other yoga because of the same reason. Because a Kosta Pariksha practically is a difficult, I don't say impossible, difficult. And assessment of the Kosta also is becomes quite difficult in practical situation, and hence we prefer to use the Trivakleha for all, like the same Alpam Mradu Aushadi. And it's better to have repeated Virechana than having a Ati Yoga. And it's in a patient who is weak, it's always better to have a Samshamana Dravya than the Virechana and Mrudu Dravya. With the Mrudu Dravya, Alpa Virechana can be suggested. You need not go into the level where you will have all that Samyak Virikta Rakshanas. Mandagnim Krurokostam the Sakshara Lavani Griti Sandukshitagnim Vijda Kapupatam Jishothet. If the patient already has a Mandagnim, if his digestive power is already lesser, before the Virechana, patient has to be given some drugs like Kshara, Lavana, Ghrita, etc. to ensure that his digestive power is enhanced and Kapha Vata is already corrected. वृक्ष बहु अनिल क्रूर कोष्ठ व्यायामशीलिनां दीप्ताग्नीनां च नभ च भैषज्यम् अविरेच्यैव जीरति तेभ्यो बस्तिं पुरा दद्यात् ततः स्निग्धं विरेचनं शक्र निषिच्य वा किञ्चित् तीक्ष्णाभिः फलवर्तिभिः प्रवृत्तं हिमलं स्निग्धो विरेको निर्हरेत् सुखम्. Some of the complications or maybe some of the problems which you come across with the administration of virechana is some of the patients who have already a krura kosta, the dravya, virechana dravya which is given may be get digested, may not produce the virechana at all. In such conditions, one of the option is to give the virechana next day. Another option is a bastim purabdhyata. A basti can be given so that the fecal material is removed and the further this expression of the material, fecal material can be stimulated. Or Instead of basni, you may even a suppository, Falavarti. A suppository also can be used to induce that first expulsion. And once the fecal material is expelled out, the next portion of the virechana can be a smooth process. This occurs quite often in a patient who has a very chronic constipation, and when you give virechana, uh, these fecolids may block the passage often, and this kind of complication occurs not very frequently, but often you may come across such complications. Vishabhigata Pitika कुष्ठशोफविसर्पिणः कामला पाण्डुमेः तान् नातिस्निग्धानं शोधयेत्. If a patient already has Visha Abhigat trauma or the skin disorders where there is already some discharges or Kamala, etc., in such patients, that Snehana process can be modified. It can be, the intensity of the Snehana can be reduced, or even without Snehana also Virechana can be given in such conditions occasionally. If there is a lot of humidity, lots of discharges from the body, Snehana can worsen the condition, and in such conditions, either the Snehana can be, the protocol of the Snehana can be minimized, or it could be avoided. Sarvan Sneha Virekeshcha Rukshestu Sneha Bhavitan. In all patients, it has to be a Sneha Dravya Yukta Virekana. And in the Ruksha Dravya, the Ruksha patients, the Dravya has to be processed with the Sneha. Now, of course, practically, this is not of a very significant issue. Karmana Mamanadinam Punarapi Antare Antare Sneha Swedo Prayojita Sneha Mante Balaita. When you do the Vamana and then the Virechana, in between, again the Snehana has to be done, Svedana also has to be followed. That means the whole process has to be as followed as a package. It's not that Virechana is given and Vamana is given directly. Once the Virechana is given, then if at all you have to start with the Vamana, again the same protocol of Snehana has to be followed. And at the end of all that process of the Samsarjana Krama, again Snehana has to be given to increase the strength of the body. Malohi Deha Utklesha Hriyate Vasasayata Sneha Svedata Utklishtah Shodhite Shodhanihi Malaha Sneha Svedan Anabhyasya Kuryat Samshodanam Kiha Dar Shushkam Ima Aname Shariram Tasya Diyate. Very important. Whenever you follow that Viretana or Vamana, the Shodhana Kriya, the Snehana is a very crucial and very important issue, and that Snehana and Svedana done would be producing the dosha utklesha, as you, in case of a cleaning of the cloth, when the cloth is kept in water for a certain duration, that mud or whatever the dirt in that soil or in the cloth becomes loosened, and it will become easy to wash off. So that snehana given prior to the shodhana will have that wash off effect. Without that, if at all you use that woman or vibration without the snehana, what I call as instant purgation, instant emesis, etc., which are not really the woman vibration, the complications can occur. Dar shushkam iva aname, like bending of a dry wood will result in breaking. Similarly, the body also can break up, and hence that should never be followed. विरेकसाध्याः गुरुनाशो विस्फोटव्यङ्गकामलाः दीनज्वर उदर दरच्छर्दिक्लीहनीमकाः विद्रधि तिमिरं काचः स्कन्दः पक्वाशैर्व्यथा योनिशुक्राश्रया रोगाः कोष्ठकाः कृमयो व्रणाः वाताश्रम ऊर्ध्वगं रक्तं मूत्राघातशक्रग्रह वाम्याश्च कुष्ठमेहाद्याः न तु रेट्या न मज्वरी. Now, Vagbata gives a comprehensive list of the conditions where Virechana and Vamana can be preferred, and where the Virechana never should be given. The list of the diseases, Gulma, Arsho, Vispota, these are the diseases where Virechana is very specifically indicated, and Kushta Mehadyaha, Vamana is specifically indicated. Navadvara, according to Bhagbata, it should not be, Virechana should not be given. Of course, that's a bit of question mark, like in Charaka and Sususa Navadvara also is indicated for Shodhana. So, where you have to have a specification condition like the status of the patient has to be assessed. अल्पाग्रे अधोगपित्तास्त्र क्षतपायु अतिसारिणः सशल्या आस्थापित क्रूरकोष्ठा अतिस्निग्धशोषिणः. Now, Virechana also should not be given in case of adhoga raktapitta and Ksatapayu, where there is an injury to the rectum. Atisarana, where the patient already has a Atisara Vyadhi, it should not be given. Atisara Vyadhi and a Swayam Pravutta dosha of a disease, these should not be confused. Atisara Vyadhi is a Vyadhi where you need to give the Samradravya. Swayam Pravritta dosha in case of a disease, these have to be differentiated clinically. Of course, it's a very complex issue. I'm not going to that part now. Today, we will have that kind of a discussion maybe in due course of time. Or a patient who has some foreign body and injury of the foreign body in the rectum area, or asthapila pluriposa. After the asthapana, immediately virechana should not be given. Asnigdha, where snehana is not done, shoshanaha, where the patient is emaciated. These are the protocols of the virechana. With this, I conclude today. It is Sushramitayan Sutrasthane, virechanadravya vikalpa vijnaniya nama, chatushthatvanushabdhyayaha. We'll conclude today, wind up today. If there are any questions. Okay, fine, there are no questions. Okay, thank you.
Thank you, sir.